Alright, so this is a 35-year-old female. This is how that cone beam CT looks like when you open it up. First thing you may notice is a little double contour here. So you have to decide, is that a real thing or is that an artifact? And I'll let you decide that. So here I'm looking through the sagittal plane. Usually I'll start with the axial, so let's start with the axial. Scroll down. Start looking at the teeth. The teeth look normal. Then look at the bone around the teeth. You may start to see something on the right side. So here's where I'm looking. This area doesn't look normal. A little bit of variation. The cortical plate doesn't look the same as it does on the other side or throughout the rest of the bone. So first you need to describe what this is. To me it looks well defined. It's possibly corticated. Let's blow this up a little bit. Maybe I'd call it partially corticated. I see some cortication here. Maybe there's some reactive bone going on around it. And internally, you have to decide, is it radiolucent, or in the case of cone beam CT, we call it hypodense, or is it hyperdense, or is it mixed? And to me, that looks very mixed. You compare it to the trabecular bone around it, and it looks more hyperdense, but it's not a uniform hypodensity. It's not homogeneous, more of a heterogeneous. And so you describe the appearance of that, and you want to call this a little cloud shape or little wispy hyperdensities. I wouldn't really call it ground glass. Maybe it's more like some cotton wool, or just kind of an amorphous mixed appearance. And is it more hyperdense in the center or around? And the anterior part of it is kind of more mixed throughout. This part looks a little bit more hypodense. You describe where it's located. Of course, it's around the apices of these two teeth. These two, we got a premolar and a molar here. So you may already know what that is, but I'll let you give your differential in a second here. We can do some different views here. If you don't just like looking in the axial, we can go to an arch section. Maybe adjust the brightness. So we're looking at the apices of this premolar and the molar. This image just looks a little washed out. There, maybe that helps. So it still looks well defined. I would still describe the distal one as more radiolucent, although in the very center of the distal, I'll call this a loculation. Looks kind of bilocular. You have one circle here, one circle there. So one at the apex of tooth number 28 or 29, whichever one you want to call that one, and one at the mesial apex of tooth number 30. The one at the mesial apex of 30 is definitely more hyperdense in the center with a hypodensity surrounding it. The hypodensity kind of varies in length. These are nice and round. Did we explain the impact it has on other structures? First of all, does it impact the teeth at all? Do you see any resorption of the teeth? Maybe you lose the lamina dura. I still think I see some PDL in here. So basically no effect on teeth, maybe effacement of the lamina dura. If you want to look at expansion, you can look in this cross-section view. Maybe the slightest bit of expansion. There's thinning of the buccal cortex. There we see a little expansion. So you get in the axial view, I like looking at that for expansion. Again, the distal one, maybe some possible expansion, but definitely some thinning of that cortical plate. All right, ready for your differential?